right. So current status, I think most of you might have seen that the county was changed into the red tier this week. Chris and the county did a good job of explaining part of the challenges that we faced where we had bad data, frankly, that impacted our status. There was a team of us today that actually was talking with Dr. Sullivan, who's our epidemiologist at the county. We're in the red tier currently, and just to give the tier statuses still, would be looking at, I think May 4th is what was stated as the soonest that we would be looking at moving into the orange tier if our numbers were there. Our numbers currently aren't on a case rates. We're still at, I think, about 8.7, and I think we need to get below 6 for us to actually be in orange status. So we're likely to stay in the red tier for, you know, a good month, most likely. And something we'll take into consideration as we look at our operational changes that are there. I do want to highlight that within the red tier, we do have a process by which we can return academic operations to campus. It's on the Do Your Part site, and I have a link on there that I don't think you'll be able to click, but at least you'll see where it's at. Really, that's for any faculty member, instructor, graduate student, postdoc. You know, the way that the current tier structures work is it's really tied towards our mission drivers and what they allow. One of the items that isn't allowed yet is administrative meetings. That's basically in the orange tiers where that's allowed. There are other things that we're currently working through, like structured activities that have sponsorship from leaders on campus. And these are where we're designing the event to be, you know, limited in its participation, making sure that we follow all the COVID protocols, and that, you know, we know that, again, we're looking at how we bring activities back to campus in, you know, more normal frequency, and we need to be intentional about it still at this stage. You know, and I think the county website's doing a great job showing where we are as a county from vaccinations and other things. And just to point that today is also, or yesterday actually, was the first day that any adult in California could schedule an appointment for the vaccination. That's a fantastic milestone, honestly. I know we don't celebrate the way that, you know, we normally would, but you know, if we think back 4 months, and at least I can say in December, we were wondering how this was going to work, and to be 4 months later, where we're at this point, where we're effectively in phase 3, the way that you know, the pandemic response is a great place to be. So I want to make sure I encourage everyone out there that is looking to get vaccinated, friends, family, the like, make sure that they get scheduled an appointment either through My Turn or the county website. And there will be activities that we'll be looking to, you know, support ongoing as well with the vaccination programs. So as we look at, there's also been changes, recognizing that more people are getting vaccinated, that the protocols are changing. And we're doing what I like to call like infrastructure improvements so that we can support some of these changes. One of the biggest ones is having an occupational health system for us to be able to actually track the records, to allow those that are vaccinated to be tested less frequently, and to make sure that we can understand kind of the public health of our campus. There's a team working on that, and we expect pretty soon to actually have that available, whereby then we as employees would upload our records to a medical record side of things. We'll have an occupational health specialist basically review the record, and then administratively, it'll then allow us to set the compliance requirements to be whether it's increased testing or not, depending on the status of the individual. So from that, one of the questions that I know I keep getting asked is asymptomatic testing if we're vaccinated. So currently, we are still requiring asymptomatic testing for those that have been vaccinated, with the expectation, again, to transition that to less frequent requirement, with the ability to kind of have our campus population information in one spot. All right, I think next slide. All right, so the last few months we've been working as a campus, and I say few months, it feels like since the beginning, honestly. We've been looking at how to plan to operate, you know, in the environment we're in. There's a couple of focuses that we've been really paying attention to. Is that, you know, in our current planning sprints, we're really looking at making sure that we enable the research operation to return to optimal environment. And I say optimal only because there's still some COVID constraints that prevent it from being normal. But recognizing that the summer is a big opportunity for the research community, and that really enabling that to the extent we can. Additionally, we want to make sure that we're prepared for the next academic year. I know we have summer session and there's things that happen around the edges on that, but really it's the eye on the prize is that let's be ready for next academic year and making sure that we're ready for the instruction that Provost Canfield and Sarah Frey shared with us last time. And then also looking at transition our operations methodically so that we can, not necessarily flip the switch, and that we allow ourselves the time to transition to this, operating model that I think we remember in 2019, but it's been a little while since we've behaved this way. So giving ourselves that permission to iterate into that. And so what we were working on from a leadership perspective is we were calling them planning sprints, and we had basically like a 8-10 week sprint we were working on where we were planning as if we were in yellow, and we identified a bunch of constraints that were going to impact our operation, assuming that the IHE guidelines were going to be fully in effect. And I say assuming because at the time that's what we were going off of. Since then, the governor has indicated that the IHE guidelines will most likely be going away, and I'll talk about that in a minute. Additionally, there was a group of us that were on a system-wide planning task force. Luanna Putney and Dr. Thelma Hurd were on the task force with others from across the system. Recommendations from that task force were made to the chancellors and President Drake around, how to approach the public health in the fall, recognizing, vaccination rates of our students and our employees, what screening requirements, what non-pharmaceutical interventions and the like. I have a couple highlighted here as things that I think we should be planning for, which is a high percentage of our students will be vaccinated, and also the goal to have a high percentage of our employees vaccinated. Individuals that aren't vaccinated will be expected to take a higher frequency of asymptomatic testing. And then face coverings at this time, and as the governor has indicated, are expected to still be worn by all. So I realize I think there's some guidance out there that speaks that having vaccinated individuals separately in a room, being able to remove it, we're not necessarily entertaining that at this time. And it's something that we'll be working with the system and others on how best we implement that. All right, next slide. And so moving beyond the blueprint is what Governor Newsom released last week. In it was the desire to fully reopen California's economy. Again, a Google search will be able to find this content. Everything that's on here is more or less directly from the site. What I'm trying to do is highlight what's relevant to us as an institution. I think there's two important caveats that the governor highlighted, which is that if the vaccine supply is sufficient for all those who wish to be inoculated, and if hospitalization rates are stable and low. And I think it's important to recognize here that the framing of this is that those who wish, and what I mean by that is to say that our expectation as a community, I think, is not that we're going to have 100%. And I don't mean our campus population, I mean just broadly Merced County. There's obviously goals of having higher rates there, but the governor here is indicating that really we're talking about the opportunity to be vaccinated versus everybody is. Additionally, the hospitalization rates is something that we've been paying attention to here in Merced, and I think we saw firsthand with the surge this past winter that was quite difficult for our small healthcare infrastructure here in Merced versus what we have across the valley. So it's something that they'll continue to monitor, and it's something that I think as we get later into the season, it'll be where the state continues to pay attention. The governor called out specifically that schools and institutions of higher ed should conduct full-time in-person instruction in compliance with Cal OSHA emergency temporary standards and public health guidelines. And so while the tiers are going away, which is what I keep referring to as the IHE guidelines for us, there are still other requirements that we're going to have to adhere to. Cal OSHA we always have to adhere to, but there's specific laws that were put in place in the fall that we're going to have to focus on. And then there's the public health guidelines. We're still looking to see how those are being nuanced. Again, typically it goes from the CDC to the state to the county. And so those will probably be in flux a little bit. But one of the things that I have not seen yet is any kind of requirement for distance, which is something that we'll continue to monitor because it has an impact for others as well. And then I think it's important, as we'll see the discussion here in a little bit, but the workplaces that promote policies that reduce risk, including improved indoor ventilation, mask wearing indoors, and other high-risk settings, as well as remote work where possible without impacting business operations. One of the things that has been happening behind the scenes is our POPD team has been assessing our ventilation, and they have reached out to third party for actually a third party opinion and just looking at how we're approaching it. I would say that our campus is actually in fairly good shape, and when I say fairly good shape, it's almost envious, frankly, in compared to other institutions. With us having new facilities and having air conditioning the way we do, we have a really a good head start on the ventilation side of things. And then as we look at the high-risk settings and as well as remote work where possible, that's where I think it'll be a good conversation with Luanna and Kevin and others on the HR team in a little bit here. California will also need to maintain the public health and medical infrastructure in these 5 areas. We kind of are like a microcosm of this, and I think of bullet points 3 and 4 as areas that we're going to be continuing to look at, right? Contain disease spread through timely investigation, cases, contacts, and outbreaks. That's something that the CRC will still be leading for our campus. Maintain a plan to scale resources to isolate and quarantine. That's, again, something we'll still be continuing to do. And then making sure that we have appropriate equipment to handle if there's a surge or the like. So, and then lastly, they highlight a transition for the blueprint. And it speaks to allowing increased capacity or numbers of persons allowed, including indoors with proof of testing and vaccination. And so in my mind, I have kind of this transition over time we're looking at of how we can, slowly ramp things up and the information that we need to support that. So again, we'll be continuing to release guidance on that and how we approach it. But these are all great things from the standpoint of where we were a year ago. And it's definitely this inflection point of our campus. One of the fun things about working from home is you can hear your kid in the next room having a breakdown, which is fun in the middle of a webinar. So with that, though, I'll pass it over to Luanna on the next steps. And I'm not sure how well you're hearing it, but I'm chuckling at my life right now.
It's not bad, Andy.
Thanks, Luanna.
These are the pivots we have to do, right?
Absolutely.
It makes us all human. Okay, so hi everyone. I'm not sure if you can see it from your interface, but we have about 373 folks on the webinar today. Appreciate you all being here. We've got our HR team behind the scenes trying to do some Q&A, answering them live or in real time. I'm going to hand it over to Kevin to go through the thought guide. But before I do that, I just want to, acknowledge that we are bringing folks back to on-site work. Those of us who have not already been working on site in a higher frequency starting July 1. And we, I want to acknowledge that there have been a lot of folks who've been on site since day 1 of the pandemic, and I want to thank those folks for their service. I know it's been really difficult, and we're coming for you. There's going to be more of us to keep watch. And hey, Andy, yeah.
Yeah, so I know we'd maybe now that things have calmed down in my house and I can recollect my thinking and I see the chat here, I'll answer just a few questions before we get into the next steps. I see Colleen's asking about wastewater testing be considered implementing. It is something that we're still assessing. I would say that, in June of last year, I remember that we did our first pass on it. And part of it is our infrastructure to capture isn't necessarily as ideal as other locations. It's one where I definitely think I like to think of it as we're still assessing, but I don't see it being honestly feasible from a financial perspective at where our sewer systems are in relation to the way that the flows that have to be captured. I've talked with Dean Matsumoto a little bit about it, and I know that Colleen, you and Mark have been working hard on this. I'm not ruling it out because I think it's actually one of those infrastructure investments that we may be looking at from a pandemic perspective that actually helps with resiliency. So it's just a question of the value associated with it. So at this time, I'd say the answer is we're not planning on any kind of additional adds to it, but it's something that we're still keeping in the back of our minds on. And then I think the question around masks indoors and folks with asthma and other breathing issues, I think we'll have to handle that as more of an FAQ and a special response to that. And then let's see here, do we have in-house monitoring surveillance system and are we using third-party stuff? Not sure the surveillance system, if we're talking about, I'll have to follow up with you on that one, Anita, to see which surveillance system we're speaking
Yeah,
to.
Lee was gonna address that one. Some that were already answered, Andy, were around vaccination. You know, what do we tell students about mandatory vaccination? I think, you know, the system-wide policy that will address students, staff, and faculty will be coming out within the next few weeks. So we will know more information, the details at that time.
Right.
But for students, we know that it will likely be mandatory. And, you know, I think, Andy, you can speak to what we say to students.
Yeah, I mean, I think that, like you said, it's likely to be mandatory, and that I think we'll be continuing to message that there's value in the vaccine regardless, and that, you know, we definitely encourage all to go out and have the vaccine. I think that it's the student side is going to just be one where we're going to have to look at the start of our fall semester and how we make sure that we do this in a timely fashion, as we look at whether there's a mandate and how we have, you know, a high level of vaccination across the student population. Obviously, it's in all of our best interest to have that, because quarantine, isolation in mass is something that wants to be avoided. So I think it's in the students' best interest and our best interest that we actually plan for a high vaccination rate.
Yeah. We have another one. Is there going to be guidance policy for informal off-campus gatherings with students, researchers that are vaccinated, adherence to CDC guidelines?
Right. I mean, I think that, you know, we're still currently in the IHE guidelines, or the blueprint, and I think that what we have to look at as a, you know, a university sanctioned event, as a frame of it. There's definitely considerations that we're going to have to take in, even ongoing, when the governor changes kind of some of the regulations. I'm in the process of working with Chris Kello in Graduate Division and others on setting what I like to call structured engagements, where they're intentional. We are inviting the participants. We have, you know, the contact information and the like. So again, we're transitioning to this point where we expect to do more of this, and I want to be planning for it. So it'll seem odd when I'm saying, please submit these types of requests, because we want to be really chewing on it and being smart about designing these. And then thinking about which practices actually continue on with us ongoing, even after the regulations change, as a means of just risk reduction and mitigation.
And there's another question about, you know, will campus be providing departments with protocols in relation to meetings, shared workspace, or will departments have to come up with this on their own? We'll talk a little bit about that in the context of bringing more staff back to on-site work. And there'll be plans that will be developed between the employees and the managers and the unit heads, the division head. But guidance will be what our current guidance is, you know, and that is that we will likely have to continue to wear our masks, stay 3 feet apart for physical distancing, right, Andy? And make sure that we don't well, get vaccinated, I guess. That's what I'm trying to say.
Yeah, and again, a lot of these things are changing on the fly. I think, you know, David, I see your question in here as well, and it's a pretty big one, and I think that's probably best discussed with the provost, you know, on and why we're approaching this. I think last fall, I know that there was, you know, I think we were definitely in a different space than where we're at today, where there was very little information on how things were actually behaving in comparison to today. I definitely think that we've learned quite a bit from both how we need to behave, and then we have the pharmaceutical interventions that are also out there. But I'm going to defer that one, the big question, to him and others, though, as far as exactly why we're going at this pace.
Yeah, and the plan for DCC, this a question was, what's the plan for DCC? Because it's an open workspace environment. We can get in a little bit more to that, but for occupancy, what we are trying to focus on is, you know, we don't want to go over 50% occupancy while we're under IHE guidelines right now per building, but that is not going to really restrict us in how many folks we have, because we typically wouldn't go over that occupancy anyway. So then it comes right down to the rules of how we each behave, right? Do your part, finding workspaces that are distanced apart. You know, if you're in conference rooms, making sure that, you know, you're distanced apart enough, wearing your mask. So it's not, the behavior is not going to be much different to try to keep us safe.
And then the DCC, actually, from just a ventilation perspective, it's quite voluminous with the air. You look at, I think, about 12-foot ceilings that are open, and you have, I know it seems like odd for the people that are immediately next to you, but in general, the space actually turns air quite well, and is, it's often you find the small rooms where two people share that actually don't ventilate well, that's at a different risk. So I personally, like, the DCC is actually in fairly good shape when it comes from a ventilation perspective.
Yeah, and there's lots of spaces that you can pick up and work from that are not your assigned space.
Yeah.
That could keep you well apart from others. Maybe we take one more question here, and then I'll pass it over to Kevin. Harant has a question. Did we address this one? I think it's a good one. If the research reopening proposal system is open again for research group labs that weren't allowed to come back to campus earlier?
Yes, absolutely. It is open. We've been trying to push it out in Friday memos, and I think Chris Keller actually sent a message out as well a couple weeks ago. There's basically one path is the research relaunch, and then the other path, I think, is, we just call it Tier 2 academic operations, and it's a ServiceNow form that is pretty straightforward, and it's really just to acknowledge that that individual is coming to campus and using their space. And there's a few spaces, especially with postdocs and graduate students, that are shared, and we want to make sure that we understand how we're sharing that space. But that process is open currently, and we are technically in the red tier. So it is something that we should be looking to, in my opinion, use and then follow all of the COVID protocols, such as the symptom monitoring, face coverings, and then the asymptomatic testing as well for being on campus. So it comes with those expectations as well.
Thanks, Andy. Okay, so let's move on. We'll now start a discussion, a little bit of deeper dive, primarily focusing on staff for a return to additional staff to on-site work. And Kevin's going to take it away.
Great, thank you, Luanna. Thank you, Andy. Hopefully everyone can hear me. I really appreciate the conversation and the questions that are coming up. And one of the things we've anticipated is, of course, you're going to have lots of questions. So we wanted to start out with helping understand that, realistically, our mission has not changed. Our campus has stepped up in the last year to ensure that services are provided for our students, for our internal customers, for our community, and to continue to do that even in the face of these changing, protocols, requirements, environments, methodology. We are still doing the same thing, and we realize that. And so one of the things we wanted to talk about with the support and guidance for you is how that really is still putting us together in on-site planning with that same place. So what we want to do is we want to make sure, as we're planning for this, that we're, one, ensuring that our campus service needs are met. And this guide that we will be pushing out to you, and the reason we haven't pushed it out, I want to step back just for a second, is because through the course of our discussion today and in the next weeks, we will be collecting more of these questions and thoughts from you, because we want to provide you with those answers. So that's where this guide has come out, and I'm going to give you a high level overview of it, and then kind of tell you where we're going with it and some of the timelines. So again, we're still driving to the same goal, ensuring service needs are met, aligning the goals of our university with, again, a vibrant campus for everyone. That includes staff, students, right, faculty, community, etc. And then 3 is that we want to make sure that those plans create an environment that is safe, mitigates the risk, as Andy's talked about, but also ensuring that you all are comfortable with those pieces as well. And if we do that in our on-site planning, very much so, we're all aligning. We're aligning the goals of our university with those of the units in the department, and with the desires and the goals of the individual. So it's a win-win-win. So that's really the framing we want everyone to look at this, is to ensure that we're meeting our service needs, right? That we have that vibrant campus that's safe and comfortable, and people feel engaged and ready to do the work that we're here to do. So that's really the big picture framing we wanted to share with you, and will be present in this thought guide that we'll be rolling out. So what do each of those mean? Because you're probably saying, well, what do we mean by service needs? So service needs really are talking about, the service for our students, for our internal customers, right? Business and quality needs. We want to build upon what, like Luanna said, everyone has been doing for the last year successfully. So let's use those innovations and improvements. We want to honor the work that's on site and going to continue to be on site, right? As Andy mentioned, this is a changing dynamic. So we need to be flexible. We need to be accounting for that change and being ready to make course corrections. Is that kind of thing, like, what can I change by next Tuesday? Fail early, fail often. These are opportunities for us to continuously improve. And to do that, we're going to have to gather data on how this is impacting our students, our entire community, right? And so that's really one thing we also want people to plan for. And I know this one's going to be a challenge, but because we're planning for potential scenarios, they can change. So we have to be somewhat flexible and iterative in that. And because of that iterative changing nature, we recognize and we understand that planning and execution, how you ensure service excellence is met, may differ across units, divisions, schools, and that's totally okay, as long as, again, service excellence is one of those drivers. So then the next piece, as we talked about, is that vibrancy. And you're probably wondering, what does vibrancy mean? Well, we are a campus with students and staff and faculty. And at times we know what that looks like: bustling, active, et cetera, the experience that our students deserve and we expect. So really, we want to include everyone in the thought about that. And it's not just about numbers or percentages, right? It's about being purposeful and intentional in the items or the things that we are doing together to then generate that vibrancy. Again, same thing, looking back on what we've done in the last year, beneficial, you'll start to see some themes here, right? Celebrating for what we've done, allowing for change, same kind of thing. Again, and it can be flexible and variable as long as we do still have that vibrant campus. If we don't, we all have to be aware that, will our students want to be here? Will we want to be here, right? So that's another thing that we're looking at as well in this plan, is we want to be purposeful and intentional. Because as I said, the last one, right, is we need to make sure that these plans account for all of the various situations that have bubbled up or will continue to bubble up. Now, can we do that on every single point? No, but we can do our best to maintain and offer flexibility, right, to reinforce that we are here and we're providing safety and mitigations for the concerns that come up, and doing our best to be collaborative in the way that we have these discussions. Again, building upon what we've done successfully in the short term and longer, now it's been a year term past, right? Looking at what changes, adjusting, and then continuing to make sure that we are comfortable with our safety protocols and procedures. So that's really the drivers, behind the thought guide and the planning that we're asking you to do. And so what we are going to do is then show you what we'd like in that plan. So your plan and campus leadership then will evaluate those plans and examine them. So we want you to provide some strategies, or consider strategies for adding that vibrancy to on-site learning and working experience. Okay. Incorporate these best practices and innovations that we've developed. Start sequencing, so forward planning for on-site work beginning in July, so people can start adjusting. They can start looking and seeing what personal changes do I need to meet, what professional changes do we need to make, and then again continue to assess the effectiveness of that from that implementation in July, and as Andy mentioned, right, continue to course correct as we need to throughout the fall term. All right. So I know we've got lots of questions coming in. I'm going to get some time for that. I'm going to push ahead. We've got like 2 more little things here to share with you. One of those is the timeline, because you're probably wondering, hey, when do we have to do this? This will be part of the thought guide that we're pushing out. We'll be sharing with you the timeline. You'll see we want you to start engaging in discussions of these draft plans as soon as possible. The thought guide will be pushed out on the 26th. You'll then have time to use that to develop your plans and push those back Joint Council will have some discussion of the divisional plans, review them. We'll have a period for adjustment. We'll finalize those. We'll have time for everyone to prepare for on-site work and revise your telecommute agreements as needed. We do know and anticipate that the current temporary telecommute agreements are going to expire on the 30th, and then we will use that same platform for adjusting and accounting for the plans. The telecommute agreements that are there, they require that information, so we will be collecting it through that. And then again, as I said, just continuous evaluation and assessment and adjustment of the plans and implementations. Okay. All right. So then the last piece that I'm gonna share here is our proposed roles and responsibilities, because we know there are questions about this as well. We know there are questions about who's going to approve the on-site plans, who's going to develop. A lot of this, as we've said, needs to be collaborative, right? In consultation with your team, we want leadership to develop these on-site plans, consistent with the guidelines that Andy was referring to earlier. And again, as they change, we will continue to update you, right? As a leader, you have discretion and responsibility for establishing working schedules. And those may be flexible. They may be differing for people. For directing resources, again, that also may be different for different units. For determining what is the best methodology or means of establishing and maintaining service excellence and delivery. And then continuously, accounting for that evaluation or assessment and course corrections as needed. Okay. So that's where we feel leadership lies. For the individual employee, that includes everybody. So leader or not, in your title, staff, faculty, whatever you are, you're an employee. We feel you all need to engage in this process, because we're not going to be able to make those plans if we don't have the honest, candid conversations to know what the challenges may be, the hurdles may be, the things that you need, your concerns, right? So engage in those conversations around effective quality service delivery. You are then accountable for reviewing that and submitting your telecommute agreement in alignment with the plans that you've developed and collaboratively built with your leadership. Implementing those and then giving feedback. Is it working? Is it not? Right? We're not going to be able to make adjustments if people aren't comfortable with giving feedback up, down, and sideways. And so this is really an important place for us as a campus to come together and know we need to be able to speak up, and we will listen up and we'll follow up. Okay. So the last piece is human resources. What do we do for you? Well, we're here to provide some advisement for all parties if there are questions about equity, about represented employees, about exceptions, all the things that have come up in some of the questions already, accommodations. We are here to help you with that in the planning and implementation of all of these work plans. So let's look at our time here. All right, we've got about 10 minutes that we can use for questions that are in the queue. And then I have one piece we're going to work with you on where we will be collecting your feedback and your thoughts. And it's going to be done in a globally collaborative way using a tool called Thought Exchange. But like I said, I want to take 10 minutes to get to some of these questions. So everyone on the panel, I haven't been looking at the questions. Do you have any we want to start with?
I've been trying to answer some.
Okay.
Let's see.
There's one that I want to say in general. Yeah. There's quite a few, I'll call them public health and medical related questions around the vaccine and the like. And I have reached out to Dr. Hurd and Dr. Brinkoff and also Dr. Sullivan, to the county Department of Health. We are looking at potentially holding called a Q&A session with medical practitioners and public health professionals. And I think that might be the space to answer some of these questions. We'll do our best to give responses to it, but we know that there's a lot of questions around this. So it's something that we are working on in leadership to see if we can host something around that.
All right, I am seeing one question here about guidance. So I'm going to answer that live. It says, will the guidance address how the campus addresses the need for remote and campus workstations, equipment, et cetera? Yes, so that has come up. One of the things that will be in the thought guide is guidance around assessing that need individually and making that determination as a manager based on the service need. So you know, you will need to have that conversation with your employee, and it will be based, we've talked about like on those service needs, how often will they be on site versus remote, those types of things. When it comes to, I know a lot of people are still concerned about the ergonomics piece. There are assessments, and we will be pushing that out for people to help make those determinations. But right now, there's no fixed policy on equipment for on-site and remote or both. And we don't anticipate that's anything that's going to be forthcoming. But again, it should be a open, candid conversation between leader and the individual based on their service.
Yeah, I agree with that. We're going to get lots of questions on, you know, on your chairs, your computers, your extra monitors, ergo equipment. But you know, different campuses are doing it differently, and if we really are focused on service need, which we want to be, because we want to provide everyone the flexibility of meeting that service need in whatever high collaborative way, which could be done remotely or in person as possible. And we want to really open this up for a lot of innovative ideas between that the employee can have those conversations with their manager. So that's why if it feels squishy to you, it is, but it means that it will give you a lot more flexibility to have those conversations with your manager. But I can tell you, I think one thing I wanted to say is, you know, we have a telecommute agreement. We've always had this telecommute agreement. We've always had the ability for folks to telecommute, and the managers have applied that differently. You know, we know that there's certain employees who can't telecommute, but for those who can, managers have in the past, pre-pandemic, applied that differently. We will probably have, we have to acknowledge, we will probably have managers applying their consideration of what is necessary service-based work in person versus remote. But that's where this fall term, we really want to use it as a practice, as an evaluative period to, you know, put in the plans. You know, we're asking managers, leadership is asking managers, unit leads and division leads to be very flexible. And that's what's different this time. So we're asking people to be very flexible, be open to innovative ideas, and then assess it. So if you've got some innovative ideas, bring them, but then also bring some ways you're going to measure how it's working.
Yeah, and I think, Luanna, to your point there, that's really the other thing, you know, we've all tried to stress here is that evaluation piece. So if we were to say, hey, first, right out of the gate, we want to get you, you know, double monitors, double, you know, stand-up desk, and then 2 weeks in, we say, hey, this isn't working. You need to be, you know, 90% of the time on site. You know, we've somewhat jumped the gun. So we want to be really reflective and evaluative in all of this as well. So that's why we've said very clearly, we want to continue to assess, right? Continuing to assess, because we may need to make course corrections based on individual as well as differing service needs and demands. Let's look at questions here. All right. So I think this is a good one. It says, who determines business need definition to establish remote work or in-person requirements is determined by each individual business unit, school, division, or by campus leadership?
Yeah, we're gonna, you know, we're asking division leads for their plans. You know, so the head of the division school will provide their plan. We've outlined a few things that we'd like them to consider, but this next month, you know, will be a period mid-April to mid-May or early May for employees to have those conversations with their unit leads, who then have conversations with the division leads. So it's going to be hopefully an iterative conversation and product for whatever hybrid work will fit and will provide the best service. But ultimately, your unit lead and your division lead will have the ultimate say, and that's the same as it kind of always was.
Okay, let's see here. So we have one here. I think this is probably on a lot of people's minds, and I want to address this because the question around this kind of came up in the pre-question. It says, I've seen other UC campuses beginning to offer 100% time remote work for some administrative positions. If UC doesn't get with the program, start to offer this. Our current staff and new hires may start seeing a large exodus of employees, especially important for professionals who can get paid much more for doing the same work for UCLA, UCSF. That's not something we haven't heard before. One of the things I want to point out from this is actually kind of a bigger concern for us around the perspective of employee engagement, burnout, those pieces. We understand that the changing demands of remote work, the changing requirements, it shifts your capacity. It puts an undue stress sometimes upon you, and that constant change is difficult to deal with. So one of the things we are looking at, and it may sound like I'm not answering the question, but I am, is that we have to account for it. So we have to adjust. We have to provide resources to support managing hybrid teams, additional work, right? This is a place where managers it's going to sound like I'm flipping the responsibility, but you have to start looking at what can I do to ensure that my folks are engaged, that the role is properly sourced for remote or on-site work, that those conversations are driven by the primary job description and functions and service needs, and then that conversation can happen with the individual. There will be some that probably can, roles on our campus that can be more remote than others. Again, like we said, that it will vary. It's going to be driven by the role and not by broad brushstrokes of, well, we should make, 60% of our jobs fully remote so that we're an attractive employer. We want to make sure that we're still letting the service needs drive that. Now, what does that mean? You may have to adjust. You may have to do some accounting for cross-training, for development of people, because some people on your team are on site and some aren't, right? So it is going to be a dynamic that we have to work with, and then we'll see as we assess, are there places where certain units can be 100% remote? And then we'll fold that into the job descriptions and the benefits of that. But to say that immediately is kind of difficult because we haven't captured that data yet, I guess is my point. And hopefully that answers the question. Andy, Luanna, David, Fabi, anyone want to add to that? I know that's a big question and concern.
I think you did well uncovering it. I think it's a hard one, and there's a couple different ways that we're seeing across the UC the approach to this. And I think the thing that I often remind is that it's going to be iterative, and that there's time to learn what works and kind of what needs to be adjusted. And I know that in the conversations that we're often in, I like to use the word both, because we talk about virtual and we talk about in person, and there's often a combination of the two that we're going to be looking at. And so I think that there is a learning element we're going to be having here as an institution around the services that need to be in person, how we deliver those well, what components can be virtual, how we deliver those well, and letting there be balance in how we achieve that.
Great. Okay, so I'm going to pivot here. I know we have a ton of questions, but I don't want you to feel that we're ignoring the questions, because where we're pivoting is a place. There was a question about, are we going to gather feedback from everyone on this and the plan and what we're asking? Yes. So that is this component. This is, I'm going to introduce to some of you probably for the first time, a tool that is called Thought Exchange. And what it is it's a place for you to contribute your ideas, your questions. So we've shared a lot of information with you around what we're asking. We've shared with you information around the thought guide. This will be forthcoming, but we didn't want to give it to you before then finding out what additional questions do you have. So given what we've shared so far, the updates that Andy provided around tier status, requirements, IHE guidelines, CDC, CDPH, all that, what Luanna shared about us keeping this new paradigm in mind as we're developing our plans, and then what I shared with you around the resources and tools and expectations, I'm going to show you a link here, and I'll throw it in the chat. Actually, let me go back real quick and get that copy it here. I need to put this into chat. This is going to go out to everyone here. You'll see a link and you can join. If you are on or have a mobile device, you are able to scan this QR code here. Thought Exchange is a place for you to come in. We're going to have, I think it's 3 quick demographic survey questions that you will see. Look there, I see that 12 jump up. We got some participants, people who used it before. Answer those questions. Then you will see the survey. Then you'll see one single question. Considering on-site work, what we've talked about, what concerns do you still have? So there's an opportunity for you to provide that question for us. But even more importantly is after you provide your thought or your question, there's a place for you to add a little bit of context, a why. So we want you to provide that so that it helps us understand more greatly your concern, okay? Then as you do this, you'll start seeing that people's thoughts that you shared anonymously, no one will know who shared what, will start populating. You'll then be able to click the next section, right, to review and rate those thoughts. So you can look and see what everyone is considering, what everyone else is thinking, and does that resonate with you? Or maybe your concern is somewhere else. What this allows us to do is get a full spectrum picture of what concerns you have, what areas that you're still wanting more information, support, guidance, additional context on. This is great. I'm starting to see that flow there. Okay. I think you are getting the hang of it. But don't forget, don't just rate, make sure you add some thoughts. Share with us. The other thing I'm going to tell you is this, we're going to leave this campaign open. So we'll be sharing out the initial responses later on through Monday memo and a couple of additional communications. Then we will continue to collect your feedback and information. The other thing I'm going to throw out here right now too is, when we talked about iterative, we realize that some of you still need additional guidance and support on how is this remote thing working. So if you recall, we had some great collaborative work and resources done with Kelly Kankan, our university ombud, and Luke Wiesner, who's our conflict resolution coach. And we have provided the Keep Calm and Remote On sessions. So we are going to put those back out. We'll be having at least 2 more. And in those sessions, we'll provide some more support and guidance, context, place for you all to discuss how's it going with the planning, what additional resources do you need, or once the plans are starting to become implemented, what additional support and resources do you need, okay? So again, I'm prattling on here, but I do see you all active. We've got 200 participants. I know there are more of you out there, so let's join in. Click the link if you need it. I'll put it back in the chat again. Go ahead, review those thoughts, continue to contribute, and I'll give you a quick view as to what that looks like. So as you can see here on the left, you can start seeing you all interacting together here, generating thoughts, connecting, and we start seeing the first set of them. So this is what we want, right? We want you to be very clear with us as to be candid. Be open, be honest. The only way we're going to be able to help with planning and moving forward is if you tell us what your needs and concerns are. So this is perfect. All right. I'm going to let people just contribute here. Are there any other major questions in the Q&A that anyone wants to address, since we have about 5 to 7 minutes still? Anything we're seeing? Because people can continue to interact with the thought exchange while we're also addressing those. Oh,
yeah, maybe.
You know what? Sorry, go ahead, Luanna.
Oh, I was going to ask the question about the assessments. Like when we say Paul's going to be, evaluative, how will we assess if it's working or not? Do we have additional context we could share around that? I mean, surveys, are we going to be doing surveys? I mean, we could potentially use thought exchange. Divisions could be using these kind of tools to assess. whether or not
I think
it's
that
working.
so where I'll go with that is I'm going to step back into a conversation that actually Fabi and David and I were having earlier today. Realistically, this shouldn't be any different than the kinds of performance appraisals and review that we're consistently doing when we're checking in with folks on how well, we still have the same competencies and goals that we need to achieve. So those things haven't changed. So we still have the same metrics to say, are our students getting the service they expect? Are we able to address the incoming questions from our global mailbox in a timely fashion? Are people still, feeling that they're getting their invoices processed the way that, it's all the same stuff. Nothing's changed in that regard. We just want to assess the implementation and the planning. So you'll use those same metrics that you've used before. We may have some additional tools, like you said, Luanna, to help with that, but it should be the same piece. And I'm going to actually advocate for something more here. This also is an opportunity for us to start connecting more, right? To have more frequent check-ins with our folks, to actually ask and engage in those questions like, how are you doing? And when they say fine, that should be a clue for you to go, okay, wait a minute, how are you really doing? Are you overloaded? Are you over capacity? Are you stretched? Is this working for you and your family? Like like Luanna said, it's squishy, but those are the real questions and concerns we need to be having right now with each other to ensure that these things are working, because it needs to work, again, like I said before, for all folks. Are we driving the university mission? Is it working for our unit and or our division or team? And is it working for the individual? Because that is, again, like I've said many times, and you'll probably hear me say it again, it's a win-win-win. And that's where we want to be. We want to make sure that we're all in alignment and it's working for everyone. Okay, this is great. Look at that, 2,000 ratings in 4 or 5 minutes. This is perfect. Love to see those participant numbers go up. Continue to add your thoughts, continue to share, please, because this is going to help us then drive this process more effectively and provide for you the resources you need more accurately and in a more timely fashion too. Other questions anyone seen while we have a few more minutes?
Let's see. So this is a good one. Have conference rooms on campus been upgraded so they can do Zoom? There were maybe only a few compared to when I'm at DCC, and it's everywhere. It's a really good question, because this how we do high flex hybrid, where you've got half people in the room, half people remote, is we all know it's a challenge. Even when you have a room at DCC or in the new buildings that can accommodate it, it's a challenge. It's a challenge because you're not all at the same focal point. You don't all get to engage in the same way. So I'll pull a page out of Andy's book that he keeps harping on, which is, we have to be very intentional, right, about how we set up our engagements. And that is, when we're in person, what are we going to do? We don't want to come to work and just sit in our desk and do Zooms, right? We can do that at home. But when you come to work, what do you want to do? Do you want to be meeting with people? Yes. High collaboration. What are those types of meetings? So that's a discussion I think that employees need to be having with their unit leads, is what kinds of meetings what is the expectation for the high collaborative, purposeful work that has to be done on site? And then that will tell you, if it's your team meeting that's all done on site in person, then you don't have to necessarily have a high offering for a Zoom participant, although we all know people's kids get sick and they have to participate by Zoom. So I'd say we need some help, some workshops in these areas about how to manage hybrid teams.
Yeah, that's one thing. So Luanna's spot on there. So our campus, as well as UC Berkeley, we're on the semester system. So we are the first two campuses to start, some of this on-site planning in regards to, students and our campus community being together again in great numbers. So one of the things we are working on collaboratively is a resource for managing hybrid teams. And so we will be pushing that out, relatively soon. It is something that's emerging, right? And a lot of the questions I've seen in the Q&A, pertain to that. Things like not having an actual break room or break rooms being closed, food options, some of those things. So those are pieces where we do need to have those conversations so we can address the flexibility or needs thereof. For folks who are on campus, on the main campus, if you were to leave campus to go get food because there aren't options on campus, you're looking at a much lengthier time for, walking to your parking space, driving, all that. So we need to make sure we're accounting for those kinds of additional changes and considerations. So that's why we want, and we're advocating for these open, candid conversations, because it is differing for differing people. And that, extends to focus rooms, breakout rooms, conference rooms, all that stuff.
There's a couple in here I just want to address real fast. I think Colleen and Hrant made a comment, about some of the administrative burden, and I definitely can share that the goal of ours is to remove as much of the burden as we can. I know we say that and you don't necessarily feel it, and I apologize for that outcome. But I think really as we were looking at fall planning, there's almost like one of these underlying principles, which is the least number of rules possible that creates an actual, engaging environment that has good mitigative practices, and so I think we'll be looking to adjust what we do, and with that kind of principle of let's make sure that we're not overburdening ourselves with I'll call it box checking or things of that nature.
Right.
Let's make sure that we really require this effort to happen, and so there's that. And then I think there was another comment on here about students in attendance. I believe it's been pretty clearly outlined to students that they should expect to be in person next fall. I don't, it might not be crystal clear. I believe housing is a big, time line right now, where I think early May is when the SIRs have the priority on housing. So there will be other, in the near future, conversations that our campus has with our student population about what to expect for the fall. But again, the expectation in general that I know I've seen it said elsewhere and read about it, is that they should expect to be here in Merced and in person, and that that's what we're more or less gearing up for. August 15th roughly was when our date is.
Yeah, and Andy, I just want to add on to what you said there about administrative burden, and also something that came in the Q&A. So that's one of the reasons why you will see in the thought guide, we don't have a prescriptive checkbox list or form at this moment that we're going to be asking you to submit, because we know that the information you're providing and the planning may be different for each group. So we will be asking you to submit that to us. I believe it's going to be going to you, Luanna, right? And we will have a deadline date for it, but we know that those things are going to look different for you based on your planning and the way you've put it out. If we will collect a lot of the information through, like we said, the telecommute agreements, because that requires you to put in some of those specifics around schedule, meetings, etc. But some of this may, it may be an Excel spreadsheet for one unit, and it may be a Word doc for others. Just as long as you're providing that information to us and we're able to collect it and have it reviewed. Because we didn't want to create an overly arduous, set of things for you to fill out because of that administrative burden. The other was, someone suggested that, a perfect opportunity for having some of these conversations is with performance appraisal. I think that's a great suggestion. Yeah, you're already getting together, build that into the discussions, because the other piece is we have asked you specifically to reflect upon the last year, and, given the COVID pandemic and the challenges we faced, what innovations and beneficial pieces to our service provision have people added. So this is a great place to look at those. So that's a great suggestion, and thank you for that. I think it was anonymous, but it was a great suggestion.
And similar to last week, we're going to do our best to get these questions that are asked that are in the chat answered in FAQ. We'll be looking to append what we either have currently up there, or page specific to this type of the questioning. So we're going to do our best to share as much as we can, and I definitely appreciate all the questions that are coming in around these things.
Yes.
It's great feedback, and especially like you're seeing in the thought exchange as well.
Yeah, and please do continue. We will remind you, the thought exchange is going to stay open. So if you're someone like me, who I'm actually an introvert and I like to stop and reflect upon things, take that time. we're not going to be worried that you haven't given us feedback right now, but we do want your feedback, you know, overall. So please do take some time and give us your thoughts and your considerations.
And then are we going to put the thought exchange in like the Monday memo with?
Yeah. Yeah, we'll have the link out there for everyone, and then we'll provide an update too, so you can see what people have shared and what the concerns and you know, focus areas are.
Yeah, and I saw Priya suggested, you know, maybe another town hall for just staff to kind of talk through some of the, you know, and have an actual dialogue, so we have fewer people, where we don't have to have a webinar, we could have a regular Zoom. I like that idea a lot, and you know, I'm definitely, I think HR would be willing to work with staff assembly and to do something like that.
Definitely.
Okay, I think we're at time. I really appreciate all the work that's gone into this. HR, thank you. Andy, thank you. And thank you all participants. These were really great questions. You know, it's going to be challenging. You know, we're going to have to come out of our houses, you know, put our sunglasses on, but the light's coming out. So I'm kind of excited to be back to think about being back together, even in a safe way. I hope you all enjoy your Friday, and thank you again.
Yes, thank you.
See you, everyone.
Bye.
Have a great weekend.
Thanks, everybody.